make video educational about cancer. My name is Unzilla Hartawan and the last number ID 078.
Hello everyone, I am Komang Kezia Yusra Sanjaya. My ID number is 074.
My name is Kadek Taori Martiani. My ID number is 076.
Hello, my name is Adelia Cahyani. My ID number 072.
Guys,
Hi Zila.
you all know about this week's English segment yet?
Huh? What task?
The assessment is about education video, right?
Well, that's really true. Then what do we do?
Aha! I have an idea! What if we just make an educational video about cancer?
Yeah, good idea.
Yes, that is really true.
Cancer? What is cancer?
Good morning, everyone. To lack of public wants to live healthy and know about dangers of cancer, make cancer suffers in Indonesia in pairs. People should know about the dangers of cancer. So, what is cancer? Cancer is a large group of diseases characteristic by the growth of abnormal cells in the body. These abnormal cells can grow and attack any part of the body. Cancer is number 2 most deadly diseases in the world. There are the 3 most types of cancer dangerous: lung cancer, breast cancer, and cervical cancer. This causes cancer in Indonesia 2020. Okay, guys. Cancer cases in Indonesia to rise, and this has led to impaired its mortality rates. Let's see the next information about cancer.
Lung cancer. Lung cancer is a condition in which cells grow uncontrollably in the lungs. Lung cancer is a significant public health problem and causes many deaths globally. Lung cancer consists of 2 types, namely primary lung cancer and secondary lung cancer. Primary lung cancer, namely cancer that grow and stop in the lungs. Secondary lung cancer, namely cancer that spread to the lungs from other area of the body. The main cause of the lung cancer is smoking. Cigarettes contain cancer, causing substance or carcinogen which trigger damage to the cell lining the lungs. Cell and tissue change in the lungs change rapidly in healthy smokers. A number of factors can increase the risk of lung cancer. Some risk factors can be controlled. For example, stopping smoking. Meanwhile, other factors such as family history cannot be controlled. The following are several conditions that arise factors for cancer, such as smoking, exposure to cigarette smoke, radiation therapy, and exposure to asbestos and carcinogens. Symptoms include like a blood in plague, breathing problems, chest discomfort or pain, feeling very tired, and so on. There is no sure way to prevent cancer. However, you can reduce the risk by taking the following steps, like quit smoking, avoid cigarette smoke, avoid carcinogen, consume fruit and vegetables, and exercise.
Breast cancer. Breast cancer is one type of cancer when a malignant cell grows in a breast tissue. This cell can form tumor, but this tumor can do physical examination with a drug name is mammography. Breast cancer like common in the woman, but can also the little number of the men. It is the reason about the breast cancer. Causes the breast cancer. Not yet to know about this specific of the reason. However, the breast cancer have many factors, including the first is age, the family history, the personal history, the genetic mutation, and the last is hormonal factor. Okay, the symptom about the breast cancer. Okay, the first symptom is lumps or change your shape in a breast. The second is the swelling in the armpit, and the third is the change in your skin breast, and the fourth is a change in your the nipple, and the last the pain or the discomfort of your breast. Okay, the next, the treatment to the breast cancer. The first and only one is to come to the surgery, and the next to the radiotherapy and the chemotherapy, and the last is the hormone therapy. Okay, to prevent about this breast cancer, you have the routine examination. For the example, your self detection about this, the symptom about this breast cancer over yourself, and routine medical checkup with a doctor. Okay, the second is healthy lifestyle. Okay, healthy lifestyle. For example, you adapting to the healthy diet according and exercise activity, and for the consumption, don't consumption of alcohol, junk food, and the last and the next on the food block your brings to our healthy self. Okay, breast cancer is the one serious condition that requires individual medical attention. If you experience suspicious about the symptom about the breast cancer, you have a risk factor. You must do the check on the with a doctor. Okay, perform regular accept your examination breast cancer. Follow your doctor and maintain a healthy lifestyle is relative to your measure to change breast cancer.
Okay, here I will explain about the cervical cancer. What is cervical cancer? Cervical cancer is cancer that grows in the cervix, originates from the epithelium or outer surface layer of the cervix. And 99% is caused by the HPV virus or human papillomavirus. The HPV virus most often identified in cervical cancer are HPV types 16 and 18. Cervical cancer sufferers often complain of the pain in the lower abdomen. Cervical cancer generally attacks women aged 30 until 39 years. Symptoms of cervical cancer are: the first is postcoital bleeding, the second smelly vaginal discharge, the third is the vaginal bleed continuously without stopping, the fourth is pain in the genitals. Okay, these are a report as early symptoms of cervical cancer. Risk factor for cancer. Cervical cancer can occur due to: the first is exposure to mutagen substance, namely hormonal factors. The second is smoking. The third is frequently change sexual partners. The fourth is do not use contraception. The fifth is infected with human papillomavirus or HPV. The sixth is dietic. The seventh is and have had a history of drug therapy. Prevention efforts are also being made by developing the HPV vaccine, which is one of the important things in the field of gynecological oncology. With various prevention efforts and early diagnosis, the death rate can be reduced. There are several ways to treat and detect cervical cancer early, namely by the first administering vaccines, and the second pap smear. The third is EVA action or visual inspection with acetic acid. The fourth is radiotherapy with linear accelerator. The fifth is therapeutic action with anti-VEGP or vascular endothelial growth factor. Okay, that's from me, and I close with thank you.